Thank all y'all for coming today, first of all. I know y'all came from several schools. This is a nice young lady was just telling me. I appreciate it. I'm a specialist in neurology, so I'm a neurologist, board certified. I've trained in two types of neurology, though. One is medical. Of course, everybody knows about medical neurologists and what they do. Basically diagnose, name it, treat it with medications and so forth. But also chiropractic neurology, which is applied functional neurology. Whole lot different world. And it particularly applies to some of the diseases we see today, such as autism that was mentioned. It's a complicated disease, and you cannot specifically target it with a drug. There may be 10 different drugs that we could target it with, and by that time the kid is basically in a coma, and we're not really helping him or her. All right, so neurology, the brain, that's what we're going to talk about today. The basic ways that it stays alive are, number one, proper nutrition. You have to have vitamins and minerals to make DNA. You also have to have protein to make DNA. DNA is critical to living nerve cells in the brain. That's one thing, what we eat. Number two, oxygen. Duh, right? You gotta have oxygen for the brain to stay alive. Number three, stimulation. A brain neuron has to be stimulated to survive. If it's not stimulated, it dies. Beautiful example, Parkinson's disease. Have any of y'all seen anyone with Parkinson's disease? You notice there's a characteristic finding with these people. It's called the pill rolling tremor. That's what we call it. You'll see them like that right there, right? They'll be sitting there and they'll have that shake. Well, in the brain, there's this substance called the substantia nigra, or dark substance. That stuff makes dopamine. And that dopamine is used by the deeper parts of the brain called the basal ganglia. They make for smooth movement. Their job is to take signals that are for movement and to make them smooth out so that your movement can be normal and not jerked. It can be smooth, you see? Now, when that substantia nigra starts dying, for reasons unknown to this day, the dopamine output goes down. Therefore, that basal ganglia, the deep part of the brain, is not getting what it needs to stay alive. It's not getting dopamine that it needs to be alive. So what did I say we needed? Stimulation, right? It just so happens that basal ganglia uses dopamine as its stimulation. So now what is it going to do? Is it going to just die? Can we just wait it out? No. It does this. The brain makes the body move so that the sensory information coming from that movement goes back to it to keep it alive. Isn't that amazing? So this is not really a symptom of the disease. It's a function because of it. It's the brain trying to stay alive. Pretty interesting, I think. So that's a basic premise of what the brain needs to function. Now, the human brain is made up of several different parts. We just mentioned the deep parts, the basal ganglia. There's the thalamus. You may have heard of the thalamus. You may have heard of the hypothalamus portion of the brain. Hypothalamus is the small, tiny little thing deep in the brain that is encased by other bone and the skull. So it's very, very important. It makes those hormones that keep your metabolic rate steady. It likes what we call homeostasis, which means steady body function. Everything just stays nice and cool. It's the one that makes it so stinking hard to lose weight if you're trying to. Because it likes everything to stay right where it is. Hypothalamus. Then you got the parts that you probably have heard of, mostly. Frontal lobes, temporal lobes, parietal lobes, occipital lobes, and then the cerebellum. Back to the thalamus for a second. Interesting point about that thing. Whatever you see, everything you see goes through that thalamus first before it goes back to your occipital lobes to be processed for vision as what it actually is. people can actually have a dysfunctioning thalamus that affects what they perceive. You know? I was in a car accident once. And I'm driving along, and the guy is turning. He's in the turning lane. He's looking at me right in the eyes. And he's turning right out in front of me. He just pulls on out, looking right at me. There's no way I could get away from him in time. But we locked eyes just as he was committed, I guess. I said, "Did you not see me?" Guess what he said? "I didn't see you." Isn't that amazing? You ever heard of that happen to somebody? "I didn't see him." How could you not see me? I was driving an F-150, right? It's processed through the thalamus into the cortex, occipital lobes, before you consciously get it, the information. Very interesting thing about the thalamus. So that's something to think about. It processes a lot of different things. Now, first of all, looking at the brain, we'll talk first about the bottom of the brain. This is the cerebellum. Has anybody ever heard of the cerebellum? You're all teachers, I guess you have. The cerebellum is mostly known for balance. People say, "Oh, the cerebellum's off and he's staggering around." Well, when you get drunk, not that any of you have ever done something like that. I'm sure you haven't. This is what you're slamming when you drink that alcohol, your cerebellum. That's why you can't talk really well, you can't walk really well, because you're damaging your cerebellum. Now, so it has a lot to do with movement, a whole lot to do with movement. Repetitive movement. This is the part of your brain that drives your car, walks you. You know, when you're driving in your car, you don't have to think about pressing on the gas or the brake, do you? You don't have to think about turning your steering wheel, do you? Because it's doing it. It's all got it in there mapped out for you. It's taking care of business, so your conscious mind doesn't even have to think about it. Now, you can't text and drive, obviously. That takes higher centers, cortex. Now, another thing that the cerebellum does, truly fascinating, that most people are unaware of, is it also remembers things. Data. Not just movement, but thoughts. This is new. This is new stuff that we've been discovering over the past 5 years. Brand new. There are almost as many neurons in these two little lobes as there are in this whole cortex. Because they're so compact. So what happens? Let's say I want to touch my nose. What happens is my cortex sends a message. So my cortex, the motor strip of the cortex, sends down a signal to the cerebellum saying, "I would like to touch my nose. Is it possible? And how do I do it?" Cerebellum then sends that message back saying, "Yes, it is possible, and this is the movements that you will use to do it." And so then my frontal lobes, which have chosen to do this, can do this. But that happens in an instant. But we know how those tracks work. They're back and forth. Which is why it's so hard to initiate movement when your cerebellum is fried, or you had a stroke, or you had a blood clot that lets go. So cerebellum, much more to them than we've known in the past. Very, very interesting. Very critical. Is there any coaches in here by any chance? Figures. You never show up for lectures. When it comes to athletics, this little guy, the cerebellum, can make you or break you. That's the difference between the great athletes and the ones who try their best to be great and can't get there. That's cerebellum. Believe it or not, there are very specific treatments that I use to treat people who need better performance. They want to do better in their martial arts. They want to do better in their dance. They want to do better in whatever sport it is that they're doing. Can be improved with proper brain function, because that's where it all starts. tell you guys that. You know it all starts in the brain. Now, moving up in the brain, we get this occipital lobe. We talked about that earlier with the thalamus and vision. That's what processes what we see. Very complicated. I won't get into details with it now. If you have questions you want me to, I will. But it processes what we see. When we see someone's face, we are processing that information. When we think of a person's face, we process information. It gets activated when this part of the brain hears a certain song. You know which one I'm talking about. You hear a certain song, you think about that day back in high school, you know? You see the face, don't you? You see the face because of this. Those occipital lobes. They say, yep, that's who she was. There you go. Broke your heart. Whatever. All right, so occipital lobes. Now, then we have the parietal lobes. The parietal lobes portion of the brain. Now, that part basically means space. It tells you where you are right now. It tells you where your foot is, where your hands are, where you are in this classroom, where you fit in your society, in your family. It tells you those things. It tells you how much space you take up in that chair. It is basically that spatial recognition part of your brain. Sometimes we'll have people who have problems with this part of their brain. It's not their cerebellum, yet they're still screwing up in sports. Why is that? Because they don't know where their arms and legs are. They got an idea, but if they don't know exactly where their arms and legs are, they're going to screw up, right? It's just inevitable. So we look at that. Now, when it comes to school, you got a kid. You're trying to teach them geometry. Oh, my Lord. Try to teach a kid geometry when the parietal lobes don't work. You got to visualize a little Johnny. Visualize what? He doesn't even know where he is, much less visualize geometry. You know? I heard a laugh. We'll talk about frontal lobes later. That's the good stuff. So, parietal lobes are critical in being able to do anything. Terrible handwriting. Parietal lobes. Things like that. They're clumsy. Oh, this is so typical in high school. Middle school, I guess it'd be even worse. Kid's going through his growth spurt. He doesn't know where his feet are. He's falling. He's tripping up the stairs all the time. They drop their books. It's not that they can help it, they can't. They don't even know where it is for that moment. They don't know where their feet are, so they trip and they fall. That's the parietal lobes. Reading maps. Being able to look at a map and know where I am and look at a place where I want to go and be able to understand how to get from point A to point B is parietal lobes. And depending on what particular thing we're trying to get this kid to perceive will determine which side of the brain we're talking about too. I'm going to get into that in a minute also. So, any questions about parietal or occipital lobes up to this point?
Is that something you can improve?
Yes, we can. It's all fixable. Even if they've had surgery, even if they've had a tumor removed, part of that brain removed, we used to think it was pretty much hopeless. Have y'all been told that? The brain does not heal? Is anybody still telling you that? Good, because it does. Used to, a person in persistent vegetative state, and a lot now, when they're in that state, it's like a coma. They're not going to wake up, they say. Just take them home, be nice to them, and wait. Right? Well, I've had so far 3 vegetative state patients brought to me. All 3 are awake. Not a miracle. Pure science. But the doctor has to take the time to assess the cortex to see what the brain needs. Not what we want to try to make them do. I work with a lot of physical therapists too. These guys, they'll go into a hospital, they've had a stroke, they're paralyzed entirely on one side. Only thing they know to do is to get that limb moving, right? I mean, the limb's not moving, it's paralyzed. But we need to make it move so it'll be okay. If there's damage to that side of the brain that causes that limb to move, and you move it, if you move it the wrong way, you're going to cause more damage. That's why a lot of these people don't get better. They do often get worse. But if they know how to do it right, which is what I do, I will assess the patient and tell them, okay, now this is how you need to do it. Then the patient gets well. Because they have to work with what the patient has. But see, they don't know. I don't get angry with them. They don't know what part of that cortex is destroyed. They don't know how to build it back up. To answer your question, I know you're thinking of. If there was a tumor or a hemorrhage or a blood clot, the part of the brain that died, I work around it, around the edges, if you will. And I will stimulate those edges so that they take over the dead function of that dead tissue. You see? That's what I do. But it takes a lot of detailed examination to figure out what's left. You can't just read an MRI and say, okay, that's what's left. It's not that simple. Because those neurons are more complicated than just looking at a picture and say, okay, that's what we'll do. Okay, so it does heal itself. It makes new connections around the dead area so we can get back to normal functioning. The biggest and the most obvious example is a child that's born with severe epilepsy, let's say. They decide to do a hemispherectomy. They decide to take half of the kid's brain out. Hopefully, it's the left side. So they take it out. It's a little baby, right? The kid grows up normal. Normal. Both sides of the body working. Everything's great. Now, if I thought that that part that's gone now is dead forever, man, would I be stupid, huh? The right side of the brain knows both sides of the body. The left side of the brain only knows about the right. So if they're lucky enough to get the left taken out, then it can take over. But since they're babies, they usually grow up almost normal when they have to do that. Because those neurons nearby grow more connections to compensate. It's a beautiful thing. Beautiful thing. Now, that's parietal cortex. Now, temporal cortex processes what you hear, has a lot to do with intellect, has a lot to do with spatial planning, circuits and things like that, if you will entertain me with that a minute. I'm going to talk about left and right in a second, but to keep it simple, just leave it right there where I just said. Hearing and some technical things. We'll talk more about that in a second. As far as temporal lobes. Frontal lobes. Now, as teachers, especially high school teachers, these are the lobes that torment you. Frontal lobes. Because that's where we live. That's where you are who you are, and I am who I am. And those guys are who make my decisions. If I want to walk out to school knowing full well what the consequences are going to be, but I'm a young man and my frontal lobes are misfiring, I do it. Consequences set aside. Those are the ones who have to make the right choices. Now we get into the left-right issue. That's what determines the type of choices that are made. You know, you hear, well, the girls, they mature faster. Yes, it's true. The girls' frontal lobes do mature faster, but not their left frontal lobes. Their right frontal lobes mature faster. Now, right and left. The right side of the brain, right frontal lobes, only deal with beauty, love, things that do with the heart, music, visual arts. You understand the concept I'm getting? Things that deal with emotion is your right brain, your right frontal lobe, your emotion. Hence the reason girls mature faster than boys, because their right frontal lobe matures faster. They think about matters of the heart, right? They fall in love, for real. Whereas boys, some of them maybe, most. So the right frontal lobe, there's your artists, there's your musicians, your great ones. You know, there's your visual artists. They're so creative, those people. But that's the emotional side. This is the kid who does something incorrectly and goes off. Emotionally, they may fall apart, they may cry, they may throw books, they may go off. Right brain. Everything is an emotional issue when that right brain is in complete control. Everything's emotional. And that's why you see it. You see it all the time. Rock stars, right? Great artists, visual geniuses, authors, great authors. Look at them. Basket cases, right? Drug addicts, jumping off of their houses. That's because of that right brain. They are creative geniuses, but if that right brain is in control, it's an emotional disaster. Now, so as teachers, do y'all deal with emotional disasters?
Every day.
Every day. Every day you do. That's that right frontal lobe. It develops slowly in men. They get to where they can actually love and understand what is going on in someone else besides them as it develops. Women can do that. Girls can do that pretty quick. Now then, you got the left frontal lobe. Very different from the right. Very different. This is this is the kids that all teachers love. He's really smart. This is the kid that makes the A's in all the mathematics and calculus and you name it. He aces all of his tests. He can concentrate in class and he can learn. He's so smart. He becomes your engineer, your judges, your neurosurgeons. But you better help him walk across the street because he's going to get run over, right? Isn't that true? Brilliant. But the right frontal lobe does not engage and say, hey man, you could get hit with a car if you don't. They get taken advantage of all the time, don't they? You know, the geek, you've seen the stereotypical geek, totally clueless, socially awkward, doesn't really know social cues very well, can't read them. Right frontal lobe doesn't see it. It's squished. And we'll talk about right and left some more. So this is your intellectual, this is your artist. Inside of us, in our brain, there really is two people. Truly. It's like a marriage. There are two people in that head of yours. We know this because there's a procedure that is often done for people who have severe seizure disorder called a colostomy. There's a corpus callosum in the middle of your brain right here. That's basically the communication between the right and left parts of your brain, your right and left cortex. That's how they communicate with one another. And that communication is constant. It is constantly back and forth, back and forth, back and forth. Now, with a colostomy though, they can't communicate with each other anymore. They're individuals. Complete, total individuals. I'll tell you of two documented cases that are in the textbooks. One, this lady came in after her colostomy. She was better. The seizures were not spreading across to the other side of the brain anymore because they couldn't. But she said, when I sit down to read, my left hand keeps closing the book. Now, can you imagine why? It's because the right brain can't read. Now, they're not communicating with each other. The left side of the brain can read, but the right side can't read. So what's it doing? It's getting bored. Staring at pages, closes the book. Right side controls the left. Closes it. Interesting, isn't it? So how do we fix it? Tell her to read out loud. Fixed it. Now the right brain can be entertained. It's happening. See how bizarre that is? These are documented cases. Another one was of a guy who had this procedure, and he came in and he says, I'm putting my clothes on with this hand, and this hand is taking them off. That's a problem. That's a real problem. That's a lot more complicated than the first one. But you see, the point of that is, you do have two different individuals in your head. You literally do. Now, the frontal lobes, like I said, are your command centers. They are your choice makers. They are your decision makers. Thank God we have them. Because we can choose which parts of our brain should function at one particular time. For example, in order for me to do calculus, like if I get this problem and I got to solve it, the only way I can solve that problem is for my left side to kick in, right? The left side is going to solve that for me. That means my right side's got to shut up long enough for me to do it, right? Now, if I'm an artist, most of the time, my right cortex is telling my left cortex to shut up. Because I'm going to create, right? So the left cortex is usually pushed down. It's constantly being inhibited. So it's really hard for these people to come out of that and actually do the mathematics they need to do. So the brain is always in a state of flux. It's always constantly changing. In order for you to think about one thing, the other systems in your brain have got to be inhibited enough for you to do it. You know, for you to concentrate right now, you can't be thinking about stuff at home, right? You can't be thinking about that date. Because if you are, you're not listening to me. You might be thinking about music. If you are, you're not listening to me. Right? So we have to inhibit one side in order to bring the other side up enough to work with it. That's where the frontal lobes come in. Now, like I said, if the kid is always doing art and nothing else, that left brain is in trouble. So we want to do different things to stimulate it. Now, since I'm talking about left brain for a second, let me just tell you that there's a little tiny spot in the left temporal lobes where God lives. Now, most people don't get told this, but I'm going to tell you because I think it's kind of cool.